Hello guys, today we will talk about cold injury, and this is our topic, and it's important for you to know how we will working with patient and what treatment we need give them. Okay, cold injury it's the result of external exposure to low temperature, delayed in general and local cooling, as well as their combination. There you see a big picture with some small topics, and now we will discuss them. First picture is hypothermia, and you see symptoms, mild symptoms, moderate or severe symptoms, and what to do. Yes, I don't will read that. You can to read yourself this. Okay, next picture is about frostbite, and after we will talk what is this frostbite. Now you just need to see something interesting in this picture. Next one is chilblain, and it's too important because it's the most often happened with patients who go into winter plays, winter games. Yeah, hockey, for example, or snowboard and other. Okay, please check it too. And the last one is immersion food. It's important too because it's happened with everybody. It can happen with everybody. Okay, and now we will talk about frostbite, and you see picture about frostbite, and you see what happened with tissue when we talk about frostbite. Frostbite is a local tissue damage as resulting from exposure to low temperature. Uh, of course, you need to know about general cooling, the state of the body as a result of a long stay. At low temperatures accompanied by a decrease in the temperature in the rectum below 35 degrees, with a decrease in the rectal temperature of less than 35. The development of hypothermia is noted. The pathogenesis of frostbite from a physiological and biochemical point of view can be schematically depicted as follows. Cold trauma causes vascular spasm, causing the accumulation of histamine, serotonin, kinins in the tissues. Next point is causing a strong pain reaction and hyperadrenalemia, which leads to a fourth point, a violation of intracapillary blood circulation. This leads to 5-point hypercoagulation of blood. After hypercoagulation, we will talk about thrombosis of small vessels with subsequent tissue necrosis. It leads to 7-point. 7-point is pronounced toxemia. And then we will talk about 8-point. 8-point is functional and general morphological changes in all internal organs and systems of the body. This was pathogenesis. And now we will talk about total cooling depending on the central body temperature. And of course, it's about general cooling. Yes, and first grade is light, light high, 35 degree of Celsius to 32 degree of Celsius. Grade 2 is medium, it is 32 and 2 to 29, and severe is below 29 degrees of Celsius. Okay, depending on the phase, you see compensation phase and decompensation phase, yes, and you understand that compensation phase when our organism feels something wrong, but he can fight with a situation, yeah. And decompensation phase, it when we start talk about pathogenesis of general cooling. Next one, chronic cold damage, and there we need to talk about cold neurovasculitis and chills. Yes, chills, not like chills, yeah, it's like chills. Okay, and cold neurovasculitis, it's damage, not damage, it's disease of organisms, of vessels of organisms, yes, of vessels of limbs. When we talk about spasms of arteries, and it happens when nervous system tell to organisms that they are very cold, yeah, and it's pathological and aggressive reaction of organisms to the cold. Okay. By the depth of the tissue lesion. And first grade, what happened? The skin in the affected areas becomes adamantoous, hyperemic, with cyanotic or marbled color. In frostbitten tissues, itching pain and tendon and noted necrosis does not develop. You see a normal tissue, yeah. In next, normal. Grade 2. The body of necrosis occurs in the corneal, granular, or in the uppermost zones of the papillary epithelial layer of the skin, usually during the first 2-3 days after the injury, and sometimes even earlier. Tense blisters filled with clear exudate appear. The bottom of the bladders is represented by the papillary epithelial layer of the skin, covered with fibrin sensitive to mechanical and chemical stimuli. Granulations and scars at the site of the lesion do not occur in the future. In case of frostbite of the second degree of butt, feet and hands, inpatient treatment is indicated. Such lesions are eliminated most often during the second or third week after injury. Grade 3. Superficial frostbite. The body of tissue necrosis phases in the lower layers of the dermis or at the level of adipose tissue. The resultant blisters contain hemorrhagic exudates. The bottom of them is blue-purple, insensitive to pain irritations after the reaction of the dead skin. Granulations and scars are formed in the future. These cold lesions require inpatient treatment. Small wounds heal through marginal epithelialization. More extensive ones require surgical treatment. We can call this autodermoplasty. And grade 4, deep frostbite, and you see that there we talk about damage of epidermis, dermis and subcutaneous tissue. And grade 4 is necrosis of the entire thickness of soft tissues and bone structures. The clinical signs are the same as for frostbite of the third degree. The morphofunctional substrate of frostbite of the extremities is a spasm of the arteries in the cooling area, which extends from the periphery to the center. The resulting tissue ischemia after 6 or more hours leads to the development of irreversible necrobiotic process, as a result of which 4 lesion zones are formed, different in clinical signs. With frostbite of the first degree, it is necessary to hospitalize the victims as early as possible. Next classification is in the course of disease, and there we talk about pre-reactive and reactive. Examination. What we need to do for patients with this pathology. Okay, if we talk about first degree, there we see 35, 32 degree, and we call it adynamic stage. Consciousness is more often preserved. Patients are drowsy, adynamic, complain of weakness, fatigue, chills, dizziness, sometimes a headache. The speech is chanted. Grade 2 medium. Sharp drowsiness, depression of consciousness, pulse 30-50 beats, weak feeling, blood pressure 80, breath 10-12 per minute and shallow. Grade 3 severe, below 26 degree, convulsive or comatose stage. Consciousness is absent, the skin is pale, cyanotic to the touch. The muscles are tense, the trism is pronounced, sometimes the tongue is beaten, the upper limbs are bent, the lower ones are half bent. Attempts to straighten them are met with resistance. In severe cases, the abdominal muscles are tense. In men, the testicles are tightened, the scrotum is reduced. Breathing is shallow, irregular, the pulse is felt with difficulty, rare, arrhythmic. The pupils are narrowed, the reaction to light is sluggish. Involuntary urination. And the last one is treatment tactics. If we talk about stage 1, currently there is a system. Treatment tactics. Currently there is a system of step-by-step treatment of frostbite aimed at quickly providing adequate care to patients with frostbite at any depth of the lesion and, if possible, to restore their health more quickly. If we talk about first stage, we need to understand that it is pre-hospital, self-inter and first aid at the site of the injury and transportation of the victim to the nearest medical institution. If we talk about stage 2, hospital provision of qualified medical care in the central, district or city hospital, outpatient and inpatient treatment of victims with mild frostbite, transportation of victims with frostbite to a specialist regional burn department of burn center. Stage 3. Specialized treatment of victims with frostbite in the regional burn department of burn center. And some rules what you need know at 100%. When helping patients with all types of cut injuries, it's necessary to adhere to the following rules. First rules: actively warm not the limbs, but the torso of the victim, not limbs. Because if you warm torso, you always will warm more blood, yes, and it blood will go to limbs, yeah. And the next one is normalize the temperature of cells and tissues with the heat of the victim's own blood by restoring vascular circulation using heat insulation dressings. Heat insulation dressing you see before. Okay, that's all. Thank you for your attention and have a nice day. Bye.